Ask anyone who's come through the doors of Arundel Medical Center and they'll tell you, these people care like no one else. It's not a platitude, not just something we say, it's something we do. But can we do it for the next generation?
My name is Katie Litton, and my daughter Mackenzie is 22 months, almost 2 years old. We had what we thought was just a simple ingrown toenail. Very quickly, things went from bad to worse, and all of a sudden we're in the emergency room. We were there with another woman had come in, and she was on oxygen, and another guy who'd OD'd or something. There was plenty going on, plenty of commotion.
For a toddler like Mackenzie, the chaos of an adult emergency department can be a frightening place. And so one of our goals as we build the new combined pediatric emergency unit and an inpatient unit will be to minimize the wait for kids. In the new unit, the decor will be child-friendly. The equipment will come in multiple sizes. We'll have the right emergency equipment to take care of your problem. How you take care of your sick children says something about a society. Arundel Medical Center is stepping up to the plate and saying, kids are a priority. Kids matter to us.
It's no secret. Most of the best medical people in the country want to be involved in research and education. If we don't provide them with a high-tech learning environment, some other hospital will.
The Health Sciences Institute, an important training facility that'll be a beacon for physicians, for the community, for the educational and training experience that all of us crave. In the background as we're shooting this, Dr. Hupp, John Hupp, is performing an operation across in the operating room, and we're able to sit here across the street in the warm confines of this room, and I envision doing live surgery there in front of 400 people and letting them see and almost in the sense, almost touch with their eyes exactly what's going on inside the body, what's going inside their bodies. Now there's the possibility for high definition cameras and video, split screens so you can see their hands as well as the wound, and then what other people are doing in the room at the exact same time. The educational experiences that we can provide for people are so much more powerful and lasting when you can give that kind of visual experience. That's what we're trying to achieve in the center up there, and unfortunately that stuff costs money. What I would tell people in this community is this is the place, this is the opportunity, and this is the time.
You or someone you know will need this hospital someday. It's not a question of if, but when.
My Aunt Audrey is 91 years old, 90 years young, and I call her twice a day and just check on her all the time. And I called, and she said, I'm bleeding. So I got in my car, ran up there, and said, you need to go to the hospital, but you're going to my hospital, which is Arundel Medical Center. She had the heart attack. She had cystitis. For me, because I am her main caregiver, it gets overwhelming, and I didn't know if I was going to be able to keep giving and giving and giving, knowing that she was going to be taken care of and taken care of very well was the biggest comfort. They were very in sync with my needs too as a caregiver. So it was all good. It was all good.
The patients and their families come in pretty frightened in the ICU. I tell them that I'm here to lend you my confidence until you can get it on your own. Time is of the essence in medicine. If they can't get into the critical care unit and they're in the emergency room, even though they need to be admitted, that's not the best care for them. I think with the expansion, we'll be able to serve the community better. We'll get 50 more hospital beds and 8 more operating rooms. So that's a big expansion. I've been on the other side of the bed. My grandmother was a patient in the hospital. I just believe that we all leave a legacy. My donation to Arundel Medical Center was really part of that legacy. And I felt that it was part of my relationship with the community to support them in this pretty significant cause, building a hospital that will touch the lives of many different people. So that's why I decided to contribute to Anne Arundel Medical Center.
We moved out here in 2001 with the anticipation that this would just be the first phase of a continued expansion.
The community is expanding so rapidly.
We want to see the best medical capability we can in the region.
I think the ability to impact future generations is probably the greatest we've ever seen.
I don't know how to describe Dr. Clemens, but he was just amazing.
It's tough to recruit people into the state of Maryland, fine physicians, and so we have to add spectacular facilities to do that.
It feels like another chapter in the life of Anne Arundel Medical Center, and we just keep getting better.
What touched my heart the most was the caring.